Hello everyone, my name is Ectopic and I'm a year 1 medical student from University Malaysia Sabah. So today I'm going to present about the female reproductive organs and the condition is about ectopic pregnancy. This is a table of contents of my presentation. So this is the introduction of the female reproductive organ. So female reproductive organ is a hollow muscular organ which located in female pelvis between bladder and rectum. The main function is to nourish the developing fetus prior to birth. This is the anatomy of uterus. Location is mentioned earlier, which is located in female pelvis between the bladder and rectum. Uterus is made up of 3 layers, which are endometrium, myometrium, and serosa. Endometrium is the inner lining, which will shed during a menstrual period. Myometrium is a thick middle muscle layer of the corpus of fundus. It expands during pregnancy to hold the growing baby. It contracts during labor to push the baby out. The third layer is serosa, which is the outermost layer. It covers the uterus and makes it easier for the uterus to slide and move within the pelvis as needed. So, there are 4 main parts of the uterus. The first one is fundus, which is the uppermost and widest part of the uterus. It connects to the fallopian tubes. The second one is corpus. It is the main body of the uterus. This is where a fertilized egg implants during pregnancy. The third one is isthmus. It is the part of the uterus between the corpus and cervix. And the last one is cervix, which is the lowest part of the uterus. So let's move on to the parturition process. Parturition process is basically known as childbirth. It's the final stage of pregnancy before delivering baby. The sign of parturition includes bloated abdomen, mucus discharge, feeling restlessness, labor and contractions, fully swollen vulva and relaxed pelvic ligaments, and lastly, development of mammary glands along with milk secretion. The hormones involved in parturition include 4, which are estrogen, and oxytocin, relaxing, and prostaglandin. Estrogen has a function in uterine contraction. Oxytocin helps in the uterine contraction also. Relaxing relaxes the pelvic ligaments and widens the cervix. While lastly, the prostaglandin is synthesized within the amnion and chorion. It facilitates cervix opening, changing the membrane structures and contraction of the myometrium. There are 3 main stages of parturition, which are dilation, expulsion, and placental. So for the first stage of parturition is dilation. It begins with the onset of labor and continues until the cervix is completely dilated. Dilation is divided into 2 phases, which are latent phase and active phase. Latent phase occurs when the cervix dilates 0 to 4 centimeters. The female delivering the baby for the first time will take 6 hours. However, the female delivering the baby for the second time will take 5 hours. For active phase, it occurs when the cervix dilates at 4 to 10 centimeters. Female delivering the baby for the first time has a speed of 1 centimeter per hour, while female delivering the baby for the second time will take 2 centimeters per hour. So for the second stage is expulsion. It starts at full dilation and continues until birth. Expulsion divided into 2 phases, which are passive phase and active phase. Passive phase is the baby head start moving out of the vagina. Active phase is the mother contracts abdominal muscles along with the uterine contractions. So the stage ends with the childbirth and the umbilical cord is clamped. The last stage is placental. It occurs when the placenta is removed and the contractions of uterus decrease simultaneously. So for this parturition process, it is a positive feedback. So it occurs when the baby pushes against the cervix and causing it to stretch. The scratching of cervix causes the nerve impulses to send to brain. Brain stimulates posterior pituitary to release oxytocin. The oxytocin causes smooth muscle lightening of the uterus to contract. So this is a positive feedback of parturition. The uterus will continue to contract but not stop contract. So next, I will talking about the related abnormal condition on the uterus. So it's ectopic pregnancy. So for the ectopic pregnancy is basically a pregnancy that happens outside of uterus. It occurs when a fertilized egg implants in a location that can't support its growth. Typically discovered early in pregnancy in the first trimester up to 12 weeks of pregnancy. So what caused the ectopic pregnancy to happen? The factor include scar tissue adhesions or inflammation from the prior pelvic surgery. Fallopian tubes have damage such as from a sexually transmitted infection, born with an irregularly shaped fallopian tube, and a growth blocking your fallopian tube. These four factors will cause an ectopic pregnancy to happen. So there are 6 common sites of ectopic pregnancy, which are cervix, ovarian, abdominal cavity, fallopian tube, ampullary, and interstitial. Fallopian tube is the most majority place to happen for the ectopic pregnancy. So for the symptoms of ectopic pregnancy is vaginal bleeding. The pregnancy woman will feel pain in the lower abdomen and pelvis and the lower back. They will feel dizziness and weakness also. So for the ruptured ectopic pregnancy, when it occurs when the fallopian tube breaks, it will cause severe bleeding, infection, and until death. So it is important to know the ectopic pregnancy earlier. So last one is a treatment for the ectopic pregnancy. The first one is a medication called methotrexate. It is a medication to stop the fertilized egg from growing and ending the pregnancy. The medication shouldn't damage your fallopian tubes. And it's important to know that this medication is not allowed to use if your fallopian tube has already ruptured. Your healthcare provider gives your methotrexate as a single injection. This option is less invasive than surgery, but it does require follow-up appointments, so your provider can monitor your HCG levels. In rare cases, a second injection of methotrexate is necessary if HCG levels don't decrease enough with one dose. The second method is through the surgery. Remove the ectopic pregnancy with surgery if your fallopian tube has ruptured. And the procedure is typically done within the laparoscopically while you are asleep or under anesthesia. So there are 2 types of surgery, which are salpingostomy, which is the ectopic pregnancy is removed and the tube left to heal on its own. And the second one is salpingectomy. Is the ectopic pregnancy and the tube are both removed. So that's all from me for my presentation. Thank you.